Kenyans who received their first Covid-19 vaccine dose will start receiving their second dose from Friday. The Ministry of Health says all those due for the jab have already been contacted. Health Cabinet Secretary Mutahi Kagwe has in the meantime announced that Kenya has recorded at least 3 new cases of the severe acute respiratory syndrome coronavirus 2. Purity Museo has more details in regard to that particular update.
The government has linked the notorious curve to the new variants detected in the country. The Ministry of Health says it has detected the Indian, UK and South African COVID-19 variants in Kisumu, Mombasa and Kilifi counties.
These variants have been designated as number 1 is lineage B117/501Y V1, first detected in the UK in September of 2020. The B1351/50502Y V2, first detected in South Africa in October of 2020.
Health Cabinet Secretary Mutahi Kagwe on Thursday called on Kenyans to observe the government containment measures to avert a 4th wave of infections.
The most important measure is the one that we keep talking about, of wearing masks, keeping your distance. That is the strongest single measure. Because, we can impose lockdowns and we can do all these things. But by the end of the day, you cannot be able to police each and every person.
Speaking at Afya House, Nairobi, the Ministry of Health officials further announced that the administration of second doses of the Oxford AstraZeneca vaccine to healthcare workers will commence on Friday.
People who are due have got an SMS on their Chanjo system, and a few of them have actually forwarded some to me. The Chanjo system is sending the reminder 48 hours to when you are due.
It is possible that the second doses, the people who have not received the AstraZeneca doses, might very well be receiving a new vaccine, specifically Johnson & Johnson. So going forward, it is likely that we are going to be using multiple vaccines rather than just one vaccine.
This even as the health department in Siaya County embarked on a village-to-village outreach program targeting vulnerable members of the community with the COVID-19 vaccine. Through the program, nurses and health workers undertaking vaccination are walking across villages in search of the elderly and other populations.
For the last 2 weeks, we've been having village-to-village outreaches. We are targeting the old people. But if we get to schools and also get the teachers, we do the vaccinations.
Nimejaribu hata kumwambia wazee wengine 3 arika yangu. Wamesema hapana, watachanjwa siku nyingine lakini sio leo. Mimi nikaona hapana, mimi lazima nichanjwe kwa maana nimekuja karibu.
So far, a total of 963,241 people have been vaccinated against the COVID-19 disease countrywide. In the last 24 hours, Kenya recorded 341 new COVID-19 infections from 3,646 samples tested, pushing the infection rate to 9.4%. Kisumu County is leading with 57 cases, Nairobi 48, Siaya 36, Mombasa and Kericho have 22 cases each, while Kirinyaga has 19 cases. 11 people succumbed to the disease, all of them being late deaths, while 144 others recovered during a similar period. Meanwhile, Kisumu County Governor Professor Anyang' Nyong'o has announced new guidelines that will ensure full compliance to the Ministry of Health protocols ahead of the Madaraka Day celebrations.
Capacity of Jomo Kenyatta International Stadium is 30,000. We have invited 3,000. That means 10% of the stadium. These people are coming with cards. Their seats are designated with proper social distancing. Our Department of Health will be on standby. Anybody without a mask will be given a mask. They will be standby for sanitizers and water and all those things.
As the sequencing by the Ministry of Health continues, it will be likely to establish the status of the country in regards to the COVID-19 pandemic, especially on how many people have been affected by the new confirmed variants of the disease. Purity Museo, Channel 1 News, Nairobi.